Welcome to the last topic of 8 in Unit 1, Section 3, Pathophysiology of Common Injuries and Dysfunctions. In this tutorial, we are going to cover various injuries that you may come across. Many of these are very common and sports massage can be very beneficial in some cases. Cervicalgia and lumbago are terms used to describe neck pain and back pain respectively. This is not associated to a direct injury, but is normally a secondary compensatory issue. You will see a lot of this. You will need to treat the area of pain as partly the client will expect you to, but it will also bring relief. If, however, you do not find the original cause, it will probably come back. Signs and symptoms for these are generally neck or back pain, hypertonic muscles, pain during movement, restrictions in specific ranges of movement, muscle spasms around the area affected, and possibly breathlessness in cases of thoracic spasms. Possible causative factors in this case are going to be woolly at best, but probably non-existent. They don't really remember doing anything, can't really remember when it started, so you'll need to put your sleuthing skills to practice here. But don't be surprised if you don't hit the nail on the head first time. You can clearly treat here. The hard one is trying to figure out what to treat. If you are unsure, work from the pain out. The client will be grateful just to have some relief to start with. Sometimes as you reduce the pain and tightness in an area, it will highlight something else. Often it can be about slowly unpicking the various symptoms till you find the cause. Whiplash, used to describe very sudden head movements, very common in road traffic incidents, other collisions and contact sports. One thing you have to be careful of here is if there is any damage to the dens peg at C1, C2. Fractures here can be extremely serious. With whiplash, there can be damage to the soft tissues or fractures to the spinous or transverse processes. Generally, the muscles of the area will go into spasm to protect and splint the area. You should not release these spasms until you know the extent of the damage, so referral is required. Signs and symptoms will be quite clear-cut. It will be sudden onset. The client will know exactly when it happened and how it happened. There will be a mechanism of injury, severe neck pain, reduced range of movement due to muscle spasms, headaches, and potential neurological dysfunction. The possible causative factors for whiplash are probably pretty obvious. They will be sudden extrinsic forces, road traffic incidents, or impact or fall at speed. There will have been excessive and fast flexion extension or lateral flexion of the neck. Many people have very mild whiplash, and in these cases sports massage can be extremely effective. I have had this myself, and massage was the best treatment. Just be sure of what you're treating. The next condition or dysfunction is a common visitor to the clinic, sacroiliac joint dysfunction. The sacroiliac joint, commonly known as the SIJ, is a shock absorber. It also has a very small amount of movement. This is a rotatory movement which allows spinal movement and the transfer of energy. The joint can become restricted. This then puts pressure on the lower spine, causing pain. Sacroiliac joint dysfunction is often associated with excessive anterior tilt. This can be unilaterally one side or bilaterally both sides. Signs and symptoms for SIJ dysfunction is dull pain over the SIJ, normally one side, pain around L5. There may be a history of a fall or trauma to the area, or a common problem is slipping and stressing the joint. Pregnancy due to the release of relaxin, asymmetry of the pelvis. There may be various restrictions and muscle tightness found around the hip, lower back and spine. This can be a complex issue to sort out and may take time. Possible causative factors are poor posture. Remember what we've said about posture. Just because it doesn't fit the normal doesn't mean it's wrong. excessively tight surrounding tissues, poor movement mechanics, poor movement patterns due to a lack or overuse of certain movement. The possible causative factors are a little bit like the chicken and the egg. Did they cause the problem or did the problem cause them? Often this can be solved with massage and exercise rehab, but sometimes when there is a long-term chronic condition, a trip to the osteopath or chiropractor can be very helpful, especially in alleviating pain. However, the underlying cause, if there is one, needs to be addressed and the overactive muscles need to be relaxed. Piriformis syndrome is another common visitor to the treatment room. The sciatic nerve can run under the piriformis, through it, or over the top. So the piriformis can have quite a lot of impact on the nerve, either by squeezing it as it runs through the muscle or by reducing the space at the sciatic notch. Signs and symptoms are tenderness in the gluteus maximus, local pain at the piriformis, radiating pain into the glutes, down the leg and into the foot. It doesn't always travel this far, but it is a possibility. A laterally rotating hip can indicate the piriformis is tight, as this is a hip rotator. Limited medial rotation being restricted by the piriformis. Reduced strength in the affected leg and a negative slump test. This test is used to rule out problems with the disc. However, I have had negative slump tests on someone who had a very bad disc issue that put them in A&E. Tests are never 100% guaranteed, so don't rely on them. Possible causative factors include poor posture, inhibited recruitment or strength of gluteus maximus, incorrect movement pattern, postural adaptations, poor stability or movement control. Once again, many of these may be a side effect of the symptom rather than the cause. Jamming your elbow into the piriformis isn't always the best solution for treatment, as this area is likely to be hypersensitive. Working out the cause is key and aim to initially reduce the pain, but massage can be very effective. Next, we look at disc herniations, also known as a prolapsed disc. This is where there is a partial or complete release of the nuclear pulposus from the annulus fibrosus in the space around the disc, potentially putting pressure on the spinal cord. A bulging disc is where the nucleus pulposus remains within the annulus fibrosus but protrudes out past the vertebral body, again potentially putting pressure on the spinal cord. Normally herniations happen posteriorly because it is usually caused by bending forward and twisting with heavy weight. It can protrude anteriorly, but this is less common. Most commonly this will happen in the lumbar section of the spine, but can happen anywhere throughout the spine. Signs and symptoms for disc herniation is pain in the local area, radiating into the glute, down the leg and into the foot. The client usually knows exactly when it happened and how. So this is sudden onset. Pain which is made worse in flexion but eased in extension and a positive slump test, but remember, not always. Possible causative factors are a combination of flexion, rotation and heavy lifting, poor lifting techniques or impact. This is not one for the sports massage therapist and should be referred. However, after the acute stage and under guidance, I have helped manage this condition. A normal treatment will include pain relief, potentially steroid injections, and in some cases surgery, although this is not a preferred option. Facet joint syndrome is inflammation of the Z joint of the vertebrae, causing articulation issues. This is common in the older population and can cause local and radiating pain. It is found in the cervical and lumbar sections of the spine. When wear and tear is more the issue rather than a strain of the joint capsule, the condition will have reoccurrences or flare-ups. Signs and symptoms of facet joint syndrome are pain in the cervical or lumbar area. Within the cervical area, the pain will normally be unilateral and usually radiate no further than the shoulder and upper back. For the lumbar section, pain normally radiates no further than the back glutes and into the hamstrings. Extension will increase pain. There will be stiffness and limited range of movement, pain or tenderness on palpation. Possible causative factors will include people who have done a lot of heavy lifting pre-20s. The older population are more likely to suffer. Work-related heavy lifting and twisting. Postural issues. Increased compression and displacement of the vertebrae, so conditions such as spondylolisthesis may be present. Obesity can be another common cause for the condition. Common treatment for this includes massage, anti-inflammatory medication, muscle relaxers, if appropriate, weight loss and physio. Often you will be looking to manage the condition rather than eradicate it, depending on the cause. If this does not provide significant relief, then nerve blocks may be considered. Facet joint lock is simply where the joint becomes locked or stuck, often caused by a structure like the cartilaginous pad becoming trapped or pinched, and will then often result in a protective muscle spasm. This is often temporary, and once structures relax, it will release. It can often be associated with facet joint syndrome. Common signs and symptoms are pain in the area that will radiate out and increase with movement, difficulty in moving, difficulty stretching and muscle spasms in the area. Treatment will often be anti-inflammatory medication, pain relief, muscle relaxants if there is a muscle spasm present, heat or ice. A visit to the chiropractor can be very beneficial. Sports massage can be useful, but not always at the start, depending on how severe the issue is. The protective muscle spasm, if released too quickly, can come back with vengeance, so often after the joint is released is good. The last condition we're going to look at is the narrowing of the intervertebral forum. The intervertebral forums in the lumbar area are normally 2 or 3 times bigger than the nerve that travels through them. When we go into flexion, that space becomes bigger. When we go into extension, it becomes smaller. Unfortunately, this space can be reduced by other causes, including spinal degeneration, bulging or prolapsed discs, any inflammation that causes edema, tissue congestion and bony growths reducing the size of the space. If there is significant reduction in space, this will create pressure on the nerve, causing issues such as neuropraxia. So you'll get signs and symptoms associated to this, which would be pain, numbness and tingling, and potential muscle weakness. If the issue becomes severe, as in my dad's case, you would end up with issues such as drop foot. This is not one for the sports massage therapist. Treatment will start with pain relief and anti-inflammatory drugs, physio, regular exercise and steroid injections. It is rare surgery will be used, but it is an option. You may be wondering why you've gone through some of the injuries and dysfunctions over these 8 tutorials, because clearly you can't treat them. Well, you need to understand them for several reasons. If working with a sport or even with general clients, you need to be able to identify these types of injuries and know when not to treat as much as when to treat. When urgent medical help is required, when referral to a physiotherapy is required, or other disciplines. You will also need to understand these injuries, as people will come to you who have had them in the past and will be part of their history and may be part of the current issue. You may have to deal with clients who currently have these issues as part of a team or even solo further down the repair process, or helping to deal with the secondary knock-on side effects. So as you can see, understanding these issues is very important. Remember to stay inside your scope of practice, and sometimes no treatment is the best treatment. Don't worry about losing a client. You will gain far more from referring people on and ensuring they get the right treatment. I have had recommendations from clients I have only ever carried out a consultation with because I've done the best for them. Other key points to remember: you may not get all the signs and symptoms that are listed for each injury or dysfunction. You may get none at all, you may get completely different ones, so don't rely on this alone. Like signs and symptoms, causative factors can also send you on a wild goose chase. Sometimes the human body just doesn't make sense, so you need to think about what's in front of you and treat appropriately. You have now completed this section of Pathophysiology of common injuries and dysfunctions and will be able to complete the quiz associated with it. You can then move on to red flags.